Hey everyone, welcome back to the channel. Today, we're diving into a topic that isn't talked about as often as it should be, vaginismus. It's a condition that affects many people, but there's still a lot of confusion and stigma around it. So in this video, we're going to cover exactly what vaginismus is, what causes it, how it's diagnosed, and most importantly, what you can do about it. Stick around, this is going to be an eye-opening discussion. And if you find this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss an update. So let's start with the basics. What is vaginismus? Vaginismus is a condition where the muscles of the vagina involuntarily contract or tighten when anything tries to penetrate the vaginal canal. This could be during intercourse, a medical exam, or even when trying to insert a tampon. The key word here is involuntary. This tightening of the muscles isn't something that a person consciously controls. It just happens on its own. These contractions can make penetration either very painful or in some cases completely impossible. Some people describe the sensation as a burning or stinging pain, while others say it feels like they're hitting a wall when penetration is attempted. If you think you might be experiencing vaginismus, here are some of the common symptoms to look out for. First, pain with penetration. One of the most common signs is pain during sex. This could range from mild discomfort to severe pain, and it happens specifically when penetration is attempted. Remember, it's not just intercourse. It can also happen when using tampons or during a pelvic exam at the doctor. Second, the inability to penetrate. For some, penetration is completely impossible due to the tightness of the muscles. It might feel like the vaginal opening is closed off or blocked. Third, involuntary muscle tightening. This is a key feature of vaginismus. The muscles around the vagina contract automatically, and you can't control or stop it from happening. This response is often your body's way of protecting itself, even though it might not feel like it. Now you might be wondering, why does vaginismus happen? What causes it? The exact cause of vaginismus isn't always clear, but we do know that it can be triggered by a variety of physical, emotional, and psychological factors. First, psychological factors. For many people, vaginismus is related to fear or anxiety around penetration. This could be due to previous negative experiences, like trauma, pain during sex, or even societal pressures that create anxiety around sex. Second, physical causes. There are also physical causes of vaginismus. Sometimes people develop this condition after dealing with chronic infections, vaginal dryness, or after childbirth or surgery, where the vaginal tissues become more sensitive or scarred. Third, medical conditions. Conditions like vulvodynia, chronic pain around the vulva, or endometriosis can make sex painful, which might lead to the development of vaginismus as your body subconsciously reacts to the expectation of pain. It's important to note that anyone can experience vaginismus, regardless of sexual history or relationship status. It's not limited to a specific group of people. Let's talk about the different types of vaginismus, because it can vary from person to person. Primary vaginismus is when someone has experienced this issue their entire life. For example, they may have never been able to use a tampon or have penetrative sex without pain or discomfort. Often people with primary vaginismus experience the tightening right from their first sexual experience or tampon use. Secondary vaginismus, on the other hand, occurs after someone has already been able to have pain-free penetration. It can develop later in life, sometimes after an injury, medical condition, or traumatic event. For example, after childbirth, surgery, or a particularly painful sexual experience. The distinction is important because it can help healthcare professionals figure out the best approach for treatment. If you think you might have vaginismus, it's really important to talk to a healthcare provider. They'll typically start by asking you questions about your symptoms and medical history. This can feel a little uncomfortable to talk about, but remember, your doctor is there to help, not judge. During an exam, the doctor may check your pelvic area to see how the muscles respond when touched. It's not uncommon for them to notice muscle tightness or spasms right away. In some cases, they might ask you to try inserting something like a small tampon or finger to help understand what's going on. The good news is, vaginismus is treatable. With the right approach, most people can find relief and be able to experience pain-free penetration. One of the most effective treatments is pelvic floor physical therapy. A trained therapist can teach you exercises to relax and control the muscles in the pelvic region. These exercises can be a game changer in helping you regain control over those involuntary contractions. Another common treatment is the use of vaginal dilators. These are small, tube-like devices that are inserted into the vagina to help the muscles gradually become accustomed to penetration. They come in various sizes, starting small and increasing as you progress. If psychological factors are contributing to your vaginismus, working with a therapist can be incredibly helpful. Cognitive behavioral therapy or sex therapy can help address any fears or anxieties you may have around penetration or sexual activity. In some cases, Botox injections can be used to temporarily paralyze the vaginal muscles, giving them time to relax and reset. This is usually considered after other treatments haven't been successful. It's really important to recognize the emotional and mental toll that vaginismus can take on a person. It's not just about the physical pain. It can also lead to feelings of frustration, guilt, or even shame, especially when it affects intimate relationships. But here's the thing, you are not alone and there's nothing wrong with you. Vaginismus is a medical condition, and with the right support and treatment, it can get better. Talking to a supportive partner or seeking professional counseling can make a huge difference. It's also important to find a healthcare provider who makes you feel comfortable, validated, and heard throughout the process. So to sum it up, vaginismus is a condition where the muscles around the vagina tighten involuntarily during penetration, but with the right treatment, whether it's pelvic floor therapy, dilators, or counseling, you can regain control and find relief. If this sounds like something you're experiencing, please reach out to a healthcare professional or visit our website for more information and support.